Hello and welcome to the program. I'm your host, Neal Howard. Thank you for joining us today here on Health Professional Radio. Our guest in studio is Dr. Lori Mosca, noted cardiologist, researcher, and also 2015 American Heart Association Physician of the Year. She's in studio today with us to talk about why heart disease and stroke remain a number one killer and the importance of secondary prevention. Welcome to the program, Lori.
Oh, thank you so much for having me, Neil.
Thank you. I understand that you're involved in some networking right now. Talk about that and how it relates to some of the latest developments in preventive care.
Well, sure. Right now, my current position is I am center director at Columbia University, our site for the American Heart Association Go Red Strategically Focused Research Network on Women. And it's really a fun activity for me because I've been involved in the field of preventive cardiology for well over 2 decades now. And I have to tell you, Neil, the reason why I got really involved in the prevention of heart disease is when I was a medical student many, many years ago. We won't say how long, but my father actually had a heart attack while I was living at home studying for the boards. And ever since then, and that was really in the early 1980s, I've just been dedicated my entire career solely to the clinical practice of preventive cardiology, and all of my research has focused on the prevention of heart disease.
Was it his first heart attack?
Yes, he was young. He was 54 years old, and he was active, but he did have risk factors for heart disease. And the good news is, Neil, he is 87 years old, and
Great.
he is very involved, with my children and all his other grandchildren. So I think the good news about prevention is we've developed such a great evidence base now for how to prevent heart disease, and that's it's a personal passion of mine as well as my professional passion.
Well, your dad's story is great in that every year more than 500,000 people experience their first heart attack.
And it's not that uncommon. Unfortunately, heart disease, as much headway as we've made, we've cut the risk of dying of a heart attack almost in half. And just in a decade, and we're making headway, but it's still the number one killer for both men and women.
How can we cut it nearly in half, and yet it remain the number one killer? I mean, are we doubling up on risk factors once we see ourselves clear?
Well, we've made improvements in some of the major risk factors, controlling blood pressure, controlling cholesterol, decreasing smoking rates. But unfortunately, our lifestyles are still not optimal. We have rising rates of obesity and diabetes. And we know that heart disease is multifactorial. There's many, many things that contribute to having heart disease and stroke. And the good news is many of them are preventable.
When you talk about recurring issues, in your opinion, what is it that leads to that second or maybe even third heart attack?
Well, that's such an important question, Neil, because we have to remember that there are 26 million Americans living with heart disease. I have a PhD in epidemiology too, as well as an MD. So I really love to talk about the epidemic because it is something that we need to understand that, again, even though we're making headway, we have a long way to go. And we can, through controlling risk factors, prevent recurrent disease in this high-risk population. In fact, people that are the most likely person that is to suffer a future heart attack is the individual who's already had one. And I think that even though we have tremendous evidence-based medicine right now to show us how to prevent it, one of the challenges is adherence. We're not always adhering to the list of prescribed medications that the doctors recommend to prevent recurrent disease, and we're not adhering to lifestyle recommendations.
If you're 54, 55 and you can have that first heart attack, what do you say to that 15, 20-year-old, now to prevent?
That's a challenge, Neil, because, it seems far off in the future, but I've had a practice that has been filled, with individuals in their 30s and 40s. And what I often say to the younger folks, it's not necessarily thinking about death. It's also thinking of just about your quality of life. You know, you don't want to live with, you know, your heart's a muscle. You want it to be fit. You want to be able to walk up a flight of stairs without huffing and puffing. You want to be able to enjoy your life. So I think prevention is not only just about thinking about prolonging life, but it's also really enhancing the life that we do have.
You know, once you recover from that incident, are you ever able to say, you know, climb that flight of stairs as if the heart attack never happened, or do you have to back off of everything while still remaining active?
Well, for many individuals, they actually do even better because
Ah.
it's a wake up call.
Mhm.
And so, you know, we always recommend cardiac rehabilitation
Mhm.
after a heart attack. And these individuals now get engaged in an exercise program. They learn about nutrition. They learn about what medications can help prevent recurrent disease.
Mhm.
And often they end up a little bit more healthy than they were before they had the event. Because remember, heart disease takes years and years and years and years to develop.
Mhm.
So it's not, you know, we manifest it clinically one day, and the day before we didn't have it. We were quote unquote primary prevention. But the reality is for most of us, you know, those seeds are planted very early in life.
When it comes to, I guess, the plaque that can build up and other issues that cause that heart attack, is there one physical thing that you see contributing to that recurrence? Not necessarily lifestyle, but that one physical thing that seems to happen time and time again when somebody's having that second or third one.
Well, yes, that's a very, very good point. In fact, many individuals that do have recurrent disease have a constellation of physical factors. They're in a pro-inflammatory state. They're in
Hmm.
a hypercoagulable state. So they often have a situation which is very deadly in and of itself. It's just sort of a brew, you know, it's a toxic brew in the arteries that cause it to really be more susceptible to recurrent heart attack.
You talked about some drugs that can prevent recurring incidents. Are there issues where a person just can't control their diet and maybe the drugs aren't the way to go as well? Are there ever issues like that, and how do you address them?
Well, we always recommend lifestyle approaches in every single patient,
Hmm.
and I think it's important to understand that that is the mainstay of preventing heart disease, and of course many other conditions as well. So we want individuals to eat healthy, and it's okay if you go to the Waffle House once in a while. You know, it's moderation, right? If we have a diet that's varied, primarily plant based, you know, we're getting good nutritious meals on a regular basis. You know, we all deviate a little bit, but we want you know, the path to be for the most part straight and narrow. You know, we need to eat really healthy. We need to avoid smoking, and we need to get regular physical activity in our days, maintaining a healthy weight. You know, if we're all doing that, honestly, there's still going to be a certain percentage of us because of our genetic landscape, no matter how hard we try.
Hmm.
Some of us, of course, are going to still go on to develop either myocardial infarction or stroke. And those individuals are the ones where, on top of that lifestyle approach, we have really a very well established list of secondary preventive agents that are proven, you know, very evidence based to prevent recurrent disease. And I think our greatest challenge in preventive cardiology has been, despite knowing all that and despite having all that evidence, we unfortunately still have a substantial portion of patients that are not adherent to these recommendations. And that's really, I think, a big target for us right now.
What's the one question that you would have other healthcare professionals in your position, or maybe someone who's just concerned about one of their patients? Sometimes it's kind of hard to get the conversation started when you suspect something. What's the one question that you can, you know, ask your patient to get the ball rolling about their diets or lifestyle, and maybe some of these preventive measures can do a little bit of good?
You know, I'm so glad you asked that question. I don't think anybody's asked me that before, but I'm going to generalize from some research that's very fascinating about how to ask patients to get truthful
Yeah.
responses. When we ask about, do you take your medications regularly? We're implying something to the patient. We've learned from research that if we Start off asking the question was, it's often difficult for patients to follow a lifestyle or to take their medications regularly. How often do you miss your pills? Then we're saying to the patient, we understand this. This is a problem. They're more likely to be truthful to you. And the amount of non-adherence is not only for lifestyle, but for, again, evidence-based preventive therapies is really astounding. So I would recommend that every healthcare provider listening in their practice develop a regular routine for how to ask patients about lifestyle. And to ask it in a non-judgmental way. Start off saying, we know that it's very difficult for patients to exercise regularly, eat well. Tell me about the difficulties you're having, or how often are you missing your medications? Just start off with a question that way, and I think that will really help open up a more honest dialogue.
Great. You've been listening to Health Professional Radio. I'm your host, Neal Howard, with Dr. Lori Mosca, noted cardiologist, researcher, and preventive cardiologist leader, in studio with us talking about why heart disease and stroke remain a number one killer, even though we've cut down the incidence by half, and the importance of secondary prevention. It's been a pleasure having you in studio today with us.
Thank you so much.
Thank you. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to this podcast on iTunes.